Good evening, my name is Lee Mengyue and I'm a student from University of Cyberjaya, MBBS 19091416. Today I'll be presenting a video about Co-Amoxyclav. Now, Co-Amoxyclav is a medicine that is used as an antibiotic to treat various bacterial infections like acute bacterial sinusitis, cystitis, cellulitis, and so on. It is a combination of two drugs, the first being amoxicillin, which is an antibiotic, and the second being potassium clavulanate, which acts as an inhibitor as a key factor that contributes to the drug overall general effectiveness. Now, Co-Amoxyclav is administered orally, and it's recommended that the drug is to be taken at the start of a meal for optimal drug absorption. The recommended dose of Co-Amoxyclav is generally 250 milligrams every 8 hours, which is about 3 tablets a day. However, depending on the disease being treated and their severity, the dose could be doubled to 500 milligrams every 8 hours, which amounts to 6 tablets per day. The course of therapy is usually prescribed by the doctor, but it can range from 3 to 7 days or even longer, 14 to 21 days. And since it's an antibiotic variant, it's recommended for patients to finish their prescribed course to ensure that all the bacteria is taken care of, otherwise there might be a chance of relapse. And if unlucky, the second batch of bacteria may develop resistant to Co-Amoxyclav. Now also don't worry if a patient happens to overdose. Antibiotics in general has a wide therapeutic index, so rarely would you have severe effects even on accidental overdose. The drug itself is a fairly acidic drug, having a pKa of 2.7 to 3.3. Its bioavailability in the circulatory system is roughly 70%. The excretion of amoxicillin is usually through renal tubular secretion, which is a fancy way of saying urination. Now, the mode of action of amoxiclav is simple. The first half being amoxicillin destroying the bacteria by disrupting the ability to form cell walls, which are crucial to maintain the cell's general integrity of the bacteria. Now, with this disrupted, the bacteria would then burst open and have their inside content ooze out. However, which basically causes apoptosis or cell death for the bacteria. Now, a few bacteria species has developed countermeasures against the action of amoxicillin by producing their own enzyme known as beta-lactamase. This beta-lactamase breaks down the ring structure of the antibiotic, rendering it useless. So this is where potassium clavulanate springs into action. It is a non-competitive inhibitor, meaning that it completely stops beta-lactamase dead on its tracks, preventing it from breaking down amoxicillin, increasing the effectivity of the drug. Seeing how well amoxicillin synergizes with potassium clavulanate, when used together they both achieve a synergistic drug effect. Now, despite the wondrous effect of this drug, it is however not recommended for patients who have known allergies to penicillin, cephalosporin, and beta-lactam agents, because consumption would otherwise be deadly, as the patient may suffer from anaphylactic shock. Other common yet minor side effects include diarrhea, nausea, and oral thrush. In certain cases actually, not some, amoxiclav liquid can cause staining on teeth, which honestly is a very, very minor setback for a medicine that treats various strains of bacterial infection. Now that's it from me. Thank you very much for listening. Thank you very much for watching.